here. Okay, so welcome, folks. We are from the Gay Counseling Training Hub. There's Trevor Hart with me and Carmine Malfitano, and I'm Scott Simpson. And our topic today is AIDS Echoes, GBT2Q Counseling during COVID. And we've got three key questions we're going to answer. And our first question is around echo. What parallels in counseling are you seeing between the AIDS pandemic and the current COVID pandemic? There are quite a few parallels that we're seeing between the AIDS pandemic and the COVID pandemic. A lot of it is around isolation, feelings of separation from not only their family and their friends, but just society in general. So that there's a feeling of marginalization, a fear of intimacy, a different type of fear of intimacy from the AIDS pandemic, where it was real sexual intimacy. With COVID, it's just sort of any sort of intimacy writ large. And there's a large sense of loneliness amongst the community, and there's a heightened anxiety and an increased experience of depression. And these things cumulatively have quite a negative impact on the quality of life that folks are experiencing during this time.
What I hear about the pandemic is that a lot of people are reverting back just as a crisis in the attachment style to their closest connections, just to receive support in times of crisis. Like when the Twin Towers fell down, the first thing that people said was, I called my family members, even though they were not in New York. Just a crisis of the attachment system, and really makes you revert to your closest connection. And for our community, the family is not always the first thing that comes to mind. So I find that a lot of people are not only feeling isolated from the pandemic, but also isolated from they're not reverting back to ask support for their own family members. This is what I'm hearing from a lot of us who are also immigrants, and losing connections from their own community. So the isolation is doubled in that there's not only in the pandemic, there was a health crisis that affected individuals who felt marginalized from their families and their communities. And I think this is another parallel that we're seeing now. I don't know if this makes sense to you.
Absolutely. Absolutely. It is definitely a theme I'm seeing in a lot of the men in our community. Okay, let's move on to the second question now, which is under the title of Disrupt. The question is, how have you used your counseling and counselor training practices to disrupt the oppressive social systems experienced by your GBT2Q clients?
Well, I think there's kind of a ways that all three of us and many of us, those of you who are watching this video, can think about what we've done to disrupt some of these oppressive social systems. First of all, I think most of us are doing counseling that empowers gay, bi, queer, and trans men, work that takes positions that are about homophobia and cisgenderism and the pain that they cause us, and the internalization of some of those negative messages that we've gotten from society, and instead to try to train people that who they are is good and they can be empowered in those places of difference. And to recognize not only the oppressions in society, but also knowing how to resist them and how to instead empower yourself. So that's some of the work that I think each of us does in our psychotherapy practice. And on top of that, because we know that there are others that would like to get this kind of training, our Gay Counseling Training Hub, our whole model and content of training is all about disrupting those oppressive social systems by providing space and processes for people to work through and to respond and to challenge the status quo. We want to help people to who are in the community, who are already working as agents of change, to provide more effective evidence-based counseling. And for folks that are seeking to be allies, to know how to better be allies, so they can kind of productively, their clients can productively engage with a heteronormative society while maintaining their own individual values.
Okay, so let's move on to our third and final question under the title of Reconstruct. So what can the broader medical and social services systems do to create more empowering and appropriate GBT2Q healthcare based upon what you have learned during the COVID pandemic? So one of the regular sort of themes that I hear from clients is, especially within the medical system, that they're not often being heard. They may have opportunities to express themselves and what they're experiencing, but they often don't feel that the person on the other side has actually heard what they've said. So there can be a lot of assumptions, stereotypical assumptions often, about what it means to be a gay person. And so I think part of the solution to that in a more immediate way is to teach listening skills. And we often say that just because you've been listened to does not mean you've been heard. So the listening skill of being able to check in, this is what I heard, does this sound right? Checking in with the client can go a long way. So that's more of an immediate solution. Looking at the larger systemic problem, I would say that the medical and to a lesser extent, the social system is not built to be improved or changed or to prevent harm. It is designed to further consolidate power and the status quo. So to be able to disrupt, we need to reconstruct the medical model and the social models as they are now, because as they are now, the gay men are towards the bottom. So we need to flip that, or at least flatten the model.
I think one important step is to recognize the wisdom that is present within a community, and kind of like move away from a system that is top down and present itself as the expert on a community that is has already knowledge and wisdom in itself, and kind of like highlight and bring that to the forefront. So decentralized care and decentralize the delivery of care in a way that is integrated with what the community already offers. I think it's a fundamental step in strengthening healthy processes and resilience that is within a community, working with the community to deliver care in the way the community needs it, and also offering knowledge and offering resources in a way that makes sense for the community, and it's integrated with the needs of the community.
Why don't you tell us about the Circle of Care, Carmine? I think you're doing some interesting work that is reconstructive.
So the Circle of Care is a new volunteer association who's committed to delivering mental health services in a way that makes sense for the community. It's an association for and by the community, with the ultimate goal of strengthening connection among men and creating community, and that decreasing disconnection, increasing connection, decreasing loneliness and isolation is already a powerful way of increasing resilience and increasing support and decreasing mental health issues as almost as a side effect of using these healthy processes and the resilience that is already within the community.
Great. Thanks, Carmine. Thanks, Trevor. And thanks you folks for watching this. If you have any questions, please reach out to us. You can find us at gaycounseling.ca.